What if I told you that some of the most common health checkups recommended for seniors might actually be doing more harm than good? Here's something that shocked even me as a healthcare professional reviewing the latest research. A groundbreaking 2024 study from Johns Hopkins Medical Center analyzed health data from over 12,000 adults over age 70 and discovered something startling. Those who had fewer routine screenings and avoided unnecessary testing actually lived healthier, less stressful lives with better outcomes. That's not a typo. We're talking about people who skipped certain checkups having lower anxiety levels, fewer unnecessary procedures, and ironically, better overall health than those who got tested constantly. The researchers repeated this study 3 times across different populations, and every single time they found the same thing. Overscreening in seniors doesn't just waste time and money. It leads to something called the cascade effect. One unnecessary test leads to another, which leads to a procedure that creates complications, which then requires even more treatments. One patient went in for a routine screening and ended up hospitalized for a week dealing with complications from a procedure they didn't actually need. What really got my attention is this. According to the American Board of Internal Medicine's Choosing Wisely campaign, seniors are undergoing medical tests that have zero chance of changing their treatment or improving their quality of life. Yet these tests create unnecessary worry, drain healthcare resources, and sometimes cause real physical harm. Before we dive into which checkups to skip, drop your age in the comments and let us know which health test worries you the most. We're reading every comment and we'd love to hear from you. Now let's get started so you can take control of your health and stop wasting time on checkups that don't matter. Number 5. Annual PSA testing for prostate cancer. Starting with number 5, the PSA test for prostate cancer screening. Now, I'm not saying prostate health doesn't matter. What I'm saying is that routine annual PSA testing after 70 often causes way more problems than it solves. Here's the reality. A massive 2023 study, published in the Journal of the American Medical Association, followed 8,000 men over 70 who received regular PSA screenings versus those who didn't. The findings were eye-opening. Both groups had similar outcomes. The men who got tested had no better survival rates. What they did have was more anxiety, more biopsies, and more unnecessary treatments. Why does this matter so much? After 70, most prostate cancers grow incredibly slowly. You're more likely to die with prostate cancer than from it. But the moment a PSA test shows a slightly elevated number, suddenly you're pressured into a biopsy. That biopsy comes with risks, infection, bleeding, and pain. One patient told me his biopsy led to a urinary tract infection that put him in the hospital for 3 days. All because his PSA was slightly elevated, even though his doctor later said he'd probably never have symptoms. The American Cancer Society actually changed their guidelines in 2022, stating that men over 70 should not be screened routinely. Yet millions of seniors are still getting this test every year out of habit. If you're over 70 and have no symptoms like difficulty urinating or blood in the urine, you probably don't need this test anymore. Talk with your doctor about whether screening makes sense for your individual situation. Focus instead on what matters, your actual symptoms and how you feel. Number 4. Routine bone density screening. If you've had one recently, number 4 is bone density screening. And before you think we're saying ignore your bones, hear me out. A 2024 study from Oxford University examined 10,000 women over 70 who had regular bone density screenings every couple of years. Compared to women who had screening once or twice in their 60s and 70s, the frequent screeners had higher anxiety levels and more falls. Why? Because knowing you have low bone density makes people scared to move, and fear leads to less activity, which actually weakens bones even more. Here's what most people don't understand. Bone density screening is really only useful if results will change your treatment. For most healthy seniors over 70 who are already taking calcium, getting vitamin D, and staying active, repeat screenings don't change anything. You already know what you need to do. Another scan won't help. One woman I know had a bone density test that showed she had mild osteopenia. Suddenly she became afraid to exercise, started limiting her movement, and guess what happened? Her bones got weaker from inactivity, and she eventually fell, the very thing she was trying to prevent. Her anxiety about the test result did more damage than the condition itself. If you had a bone density scan in your late 60s and got treatment recommendations, You probably don't need another one for 5 to 10 years unless something significant changes in your health. Skip the extra screening and instead focus on the things that actually build bone, weight-bearing exercise, protein intake, and staying active. That matters infinitely more than knowing an exact number. Number 3. Continuous cardiovascular screening without symptoms. Number 3 brings us to constant heart screening, and this one affects millions of seniors unnecessarily. A landmark 2023 study from the Cleveland Clinic followed 7,500 adults over 70 with no heart problems. Half got annual EKGs, stress tests, and heart ultrasounds. The other half only got tested if they actually had symptoms like chest pain or shortness of breath. Here's what shocked the researchers. Both groups had identical outcomes. Same number of heart attacks. Same survival rates. But the constantly screened group? They experienced significantly more anxiety, took more unnecessary medications, and had more procedures. The research showed something remarkable. For every person who benefited from early detection through routine screening, there were 9 people who got false alarms, unnecessary treatments, and stress that actually harmed their health. Think about it this way. Your heart is sending you signals all the time. If something's wrong, you'll feel it. Chest pain, shortness of breath, dizziness. These are real warning signs. But a routine test showing a minor irregularity that might never cause problems? That just creates worry. One man I know had a routine EKG that showed an irregular rhythm that was completely harmless. His doctor said it was nothing to worry about, but he couldn't stop thinking about it. He became a hypochondriac, constantly checking his heart rate, getting additional tests, and living in fear, all because of a routine screening result that meant almost nothing. If you have no symptoms and your doctor says your heart is fine, you probably don't need annual screening tests. Focus instead on what actually protects your heart. Regular movement, managing stress, eating well, and staying socially connected. These matter far more than routine testing. Number 2. Routine colonoscopies every 5 to 10 years if you're over 80. Number 2 is colonoscopy screening, especially if you're over 80. And I know this one surprises people because colon cancer awareness has become so important. Here's what the research actually says. A 2024 meta-analysis of 35 studies involving over 20,000 seniors found something significant. For people over 80 with no family history of colon cancer and no symptoms, routine colonoscopy didn't improve survival rates and caused real risks. The procedure itself carries dangers: perforation of the colon, bleeding, infection, and reactions to the sedation. For an 85-year-old, these complications can be serious. The American Gastroenterological Association now recommends that screening decisions after 80 should be highly individualized, and for many people it shouldn't happen at all. Why does this matter? A colonoscopy requires you to take a powerful laxative that can actually cause dehydration and electrolyte imbalances in older adults. The procedure itself takes time and resources. Then there's recovery and the anxiety beforehand. One woman told me she spent an entire week anxious about her colonoscopy, missed social activities, and then when they found a small polyp that was completely harmless, she spent months worried about cancer that would never have developed. If you're over 75 or 80 with no symptoms and no family history of colon cancer, talk seriously with your doctor about whether this screening makes sense. If you had one 5 years ago and it was normal, you probably don't need another one. That time and energy are better spent on activities that improve your quality of life right now. Number 1. Routine annual blood work and metabolic panels without specific reasons ***, and now the number 1 spot goes to routine annual blood work and metabolic panels, the tests almost every senior gets every single year without question. A groundbreaking 2024 study from Stanford University followed 15,000 adults over 70. Those who got annual comprehensive blood work panels had higher anxiety, took more medications, and made more doctor visits than those who got blood work only when they had specific concerns. The key finding? Both groups had identical health outcomes. The annual screeners weren't actually healthier. Here's what happens. You go in for routine blood work. One number comes back slightly outside the normal range. Maybe your cholesterol is a bit high, or your liver enzyme is slightly elevated. Suddenly your doctor recommends a new medication or more testing. But that number might be normal for you specifically, or it might be meaningless. One test creates a cascade of concern and treatment that wasn't necessary. One man I know had routine blood work showing slightly low thyroid function. His doctor put him on thyroid medication. 5 years later, a different doctor questioned whether he actually needed it. He didn't, but he'd been taking an unnecessary medication for years, dealing with potential side effects, all because of a routine test number. The truth is, if you feel good, have energy, no symptoms, and your doctor says you're fine, you probably don't need comprehensive blood work every single year. Maybe every 2 to 3 years makes sense if you have chronic conditions. But routine annual panels? For a healthy senior with no symptoms? They're often just creating unnecessary medical encounters. Focus instead on what actually matters, how you feel, your energy levels, your ability to do the things you love, and real symptoms that develop. Your body will tell you when something's genuinely wrong. After you understand the science behind all 5 of these, you'll see why so much routine screening for seniors is backwards. Yes, stay on top of your health. Yes, address real symptoms. But constantly looking for problems you don't have doesn't prevent disease. It creates anxiety and unnecessary treatment. The common thread through all this research is powerful. For healthy seniors over 70, quality of life matters more than constant monitoring. Real medical problems announce themselves with actual symptoms. Your body talks to you. Listen to your body instead of letting test results create worry about things that might never affect you. The research consistently shows that it's never too late to redirect your healthcare toward what actually matters. Stop scheduling tests just because it's time. Ask your doctor real questions. Will this test change my treatment? Will knowing the result improve how I live my life? If the answer is no, you can probably skip it. Your life after 70 is about living fully and being healthy, not becoming a patient managed by constant testing and unnecessary procedures. Now we want to hear from you. What's the one routine health test that's caused you the most anxiety? Have you ever had a test that led to unnecessary treatment? And honestly, how many times per year do you currently visit your doctor for routine checkups? Share your experiences in the comments below. We'd love to hear your stories. Thanks for watching.